Okay, so hello everybody. My name is Marco Alfano. I'm a research fellow at the Innovation Value Institute, Manufacturing University, and I am also the leader of the Digital Health Cluster. And today I will just make a presentation of the main activities that we do at the Health Cluster, Digital Health Cluster, that is mainly based on the trust person-centered health and well-being, because there is a big revolution in the digital health that is going on. So I will just highlight some of the main topics that are going on and what we are doing, and of course leave room for discussion if we wanted to contribute. And so the vision comes from six keywords that I did not create by myself, but I really found that they are perfectly aligned with what we are doing. And this vision is related to this new way of looking at health. That is, there is a revolution going on. And of course, it's related to the digitalization, but it's not just digitizing the processes, the process of the health environment, but is really creating new model of the health for the digital health, where person is at the center. The person is really empowered to understand what is happening with his or her health, taking action, of course, with the medical professionals, and cooperating, and also integrating all the digital technologies that, of course, we see in many fields in the healthcare are really finding they have a big impact. So that we have these six keywords that I was saying about searching and use the trustworthy online information, the user experience and empowerment on the medical field, other field, the telehealth and connected care, the chatbot and virtual assistants, and apps for health and well-being, a new organizational model are all kind of working together to really create this new environment where we, beside having just as I said, the digitization of the healthcare system, we have a new model, and there is a demand that is coming both from the main health organization, like the World Health Organization, with the global strategy, where it puts the power, the patient and the patient empowerment really at the center of the digital health strategy. The EU, of course, health and the care and the digital single market, again, is looking at these important aspects. And also the Ireland Launcher Care Plan, there is a citizen care master plan. So citizen and patient in general is very important, it's topical. And there are also some important organizations like the Healthcare Information Management System Society or Deloitte that are really going the same message. We are really going towards this direction. And of course, there is also some figures that say that the digital health market will be growing quite significantly in the next years. And the drivers are, of course, the rise in aging population, chronic disorders. We have heard a lot about that. And the COVID-19 that has been an accelerator for the use of remote services. But at the same time, and even before COVID, there was a big demand of the integration of digital health system, and also of increasing demand on the home-based remote monitoring and management, so that everything works in an integrated way. People stay at home, people work mainly for their for prevention, for their well-being. So it's not just looking after they have a problem, but really preventing illness. And of course, at the same time, is the pressure to cut healthcare costs and the government initiative. For example, there are a lot of initiatives about, and also financial support for patient empowerment, because it is considered a win-win initiative, because an empowered patient is someone who understands is health and becomes an active actor, but at the same time is saving costs for the healthcare system in general. Of course, there are some barriers because there is a disconnect between the old or the traditional way of caring of the healthcare, but that is focusing on disease management, and this new way of looking at the person-centered health and well-being. And we have a lot of health applications and services, but they really work as a silos. There is no integrated environment. And also there is a low health literacy about patients, so that so far they are starting, they look, for example, for information on the internet, but they are not really literate health literacy, because it's important they really understand what is about their health, in order again to take action, to take active role about their health and well-being. And of course, there's still the high cost of telehealth devices, and there is a certain resistance of physicians about the use of remote monitoring system in general of telehealth, because the rules are not clear. It's not really clear if a remote visit has the same meaning or is valid as much as a visit in person. So there are still problems with the standardization with the organizational models. So there are still barriers, and of course, but nevertheless, this is the direction where we are going. And at IVI, we have different research clusters, but we have a specific research cluster on digital health, and exactly the same name, digital health for person-activated health and well-being. Again, for us, it's very important. The person is at the center, but of course, the patient is collaborating with the medical professionals. So what are we doing? We are doing different activities, and this is just an overview of them. And we have created, first of all, and we say that they have different applications. So we created a digital app ecosystem. We see really a connection among the different applications. This is something that is very important. This is also the website where you can try to use some. We developed some application, some we will find on the internet. It's important that we have a single entry point to the different application for the patients, but also to connect to the different to the healthcare professionals or providers. And so in this case, for example, for the different the main three steps of the empowerment, for finding and understanding information, for deciding, informed decision, and for acting, and also managing, there are specific application. And also we have an integrated communication model among, this is very important, we have been working on that among all the different healthcare stakeholders, and we have developed some application that translate, so that translate medical terms in simple terms, so that the patient and doctors, for example, can simplify their communication, they can really understand each other, but of course also applies to the different to other actors. And another initiative, very important, where we are working, is the digital health and well-being capability maturity framework, where using the ITCM framework that has been developed in IVI for the maturity framework for the assessing the maturity level, the digital maturity level of organization, we are trying to create a specific model for the digital digital health and well-being. So very important, very specific. Other two initiatives are one about looking and searching trustworthy AI for patient empowerment, because it's important when you go to the internet that you, of course, when you use Google, you find everything, but what is really meaningful for you? What is something that you can really trust? And when we say trustworthy, it's not something that it should be trustworthy for the patient and for the person or the user, so that we are really looking at this aspect, trustworthy AI in healthcare, patient empowerment, but also information, health information quality. And last but not least, the intelligent health empowering agent that we started to discuss and to design is an agent that understands user requirements. For example, in terms of compliance, here you see the initial interface where the user can specify is some basic information like the age and the gender and what is a feeling, what are the compliance in a very easy way. And then you have you can select a list of compliance very focused, and the user will be provided again also in this case with trustworthy information for understanding what is going on, and together is not a self-diagnosis system, but is helping the user to understand, and together with the medical providers, the healthcare providers, to really make the understanding and make the decision about their health, and of course self-monitoring their daily life, so that in this case the system will interact. So it's really an assistant, a virtual assistant that will interact on a daily basis with the user, will learn from the user, of course, feedback, and will provide him or her with the best information and the best decision. And so this is again some of the activities that are going on with. Here you see just at the center some of the institutions or companies that we are collaborating with. But of course, these are ongoing activities. We are continuing these activities, and we are searching for new partners. So there is, of course, we call for collaboration, and for all the digital research clusters. In this case, again, I'm talking about the digital transformation for trusted person-centered health and well-being. And so we are looking for companies, enterprises, public bodies that are interested in joining our activities or create a new project in this field, and they should contact the Innovation Value Institute at info@ivi.ie. And so just to give some news about next events also of IVI, that is not all, of course, just the digital health. This is what I'm talking about. As I show you, there are different research clusters. Tomorrow there is still time to register for a very important event, that is the Perform European Digital Retail Summit. And so if you have not registered, I invite you to register, and this is the address where you can register. And in any case, you can keep in touch with IVI in all possible ways. Let's put in this way. Besides the fact that we have IVI webpage, but we are in Twitter, we are in LinkedIn. You can subscribe for our newsletter, and again looking at information about IVI in the webpage ivi.ie. So I stop here, and I wanted to give time if there is someone who wants to discuss. Again, I want to just to highlight, we could go much deeper, but I want to just really put some stress and some to me important ideas, information about how the digital health environment is moving forward. If someone wants to say something, is very welcome.
Maybe like from my side. So thanks, Marco. Also like mentioning IVI overall and the research clusters what we have, but also providing insight into the digital health research cluster. And like I think what's really beneficial is basically looking at, with the digital retail, we have a big consortium and insights into the shift, and particular over COVID, the last 12 months, 14 months somewhere, on digitalization. And I think digital retail or the retail sector moved very fast. Now I look at the health sector and health ecosystem. And even in Ireland, with the current challenges on cybersecurity, cyber risk around this, it will be interesting to see how fast the digitalization goes there. Generally, there are always challenges in the healthcare sector to digitalize processes, to change things. Did you have an opinion on why it's so slow compared to others? Like fintech is already well advanced. Digital retail, I think, picked up quite a lot over the last couple of months, and healthcare seems to be somewhere maybe a little bit slower.
Yes. Okay. Beside the fact that maybe it would be too easy to blame HSC, that is, of course, it has its own, let's say, pros and cons. Is in some way having a centralized structure is, let's say, benefit for the healthcare. In the other cases, for example, I'm comparing with Italy. And where we have a more, for example, we have healthcare at the regional levels, and is moving much faster, because here everything is centralized with the HSC, and of course you have the pros and cons, and to me, it really, you were mentioning a digital retail, you are mentioning a fintech where you have competition, and where you have a competition, where you have different actors, things move much faster. In the healthcare, where you have, in this case, you have, for example, a single actor, is kind of still top-down approach, and things not always work quite well. And of course, we also the cyber security issue of HSC, that is a clear indication that everything is integrated, because it's not only, because at that point there is no point to have a very advanced, for example, electronic health record if your system can be accurate so easily. Is a big problem, so that you have to create and you have to advance in all the different aspects of the digital transformation.
Yeah, I see there are other ones as well, like Sore, I think, and then Michael raised the hand. So sorry.
Yeah, thanks very much for the presentation, Marco. It was interesting. And then I was thinking a little bit more details on the maturity model that you have been saying you have been creating for the digital health. Then I was thinking that because you have been thinking of 8 different factors around this maturity model, my question was that it seems that this is supposed to be applied or be used to assess the digital health in city level. Then my question is that have you ever been thinking of making it like a model which is applicable at the organizational level? Because in this, the current one, you have, for example, the community web and many different elements in the health system. And yeah, that's the question. Do you have any type of thinking to make it more applicable to the organizational level?
Yes, first of all, just to clarify, this digital health, let's say the evolution of the ITCM framework for the digital health is a project that has been followed by Michael, also Paul, so that probably Michael, I don't know if you wanted to say something more about that, but in general, so that I will give Michael immediately the word. But just in general, yes, we are looking at the organizational level in this case, but also is important. For example, we were looking, and just to recall a recent experience that we had about cybersecurity, where we created the cybersecurity maturity framework for the country level, because it's also important to understand what the different countries do. For example, in terms of, in this case, for cybersecurity, but also we could apply that to the healthcare system. What do you do at the country level, so that you can have a kind of double you have kind of double aspects. So the aspect of the organization, when you want to create a maturity and understand and move to a new maturity level at the organization, but also at the country. And this is related also to what Marcus was saying. For example, what is happening in Ireland? We could make an evaluation of HSE, and is an organization, it's a country level. I don't know in that case, because it's probably is a little bit of both. But I stop when maybe Michael wants to say something more. Oh, okay, Michael is not there.
Then I think Boyega has also a question.
Yeah, just to comment, Marco. So in the health system in Ireland, there's actually 3 levels. So you have the hospitals, you have the hospital groups. So we have about 7 hospital groups in Ireland, and the management is actually a bit different. So you may actually be looking at like a 3-tier system where you have first maybe the maturity at the individual hospital level, and then you have one at the group level, and then we can, of course, extrapolate that to a national system. But I think the group level is actually maybe even more important than the national one, because the group at the group level they actually control what's happening around the hospitals under them, and they give the guidelines and framework for how they work. So no, that was just an input that there's actually something in the middle that's so important, particularly in Ireland, and they're actually moving towards maybe complete independence for those groups.
Yeah, that's an interesting perspective, Boyega. One of the strategic objectives of Sláintecare is to move out of the hospital and move back into the community. So, and this is where digital has real value and real power. That if we look at digital as an enabler to move away from the 20th century structures of how hospital groups are formed and bring healthcare interventions back into the community, and as Marco says, with this patient at the center rather than the institution at the center. One of the things we're looking at with the maturity model we're developing is, what does the capability to do that look like? So it's not just the capability to treat patients using traditional patient pathways. It's how does the system, to come back to your point, Zoe, how does the system flex to wrap around the patient rather than the patient coming into the system and essentially been treated like a project, which is they are at the moment. You check into a hospital, they start the project, you get a series of treatments, and then you're discharged. So you're treated like a project essentially by the staff, project management approach, workflow approach. How do you adapt that model? How do you adapt the thinking of people? And this is where digital is really helpful. So when we look at the maturity model that we're currently trying to partner, I guess, with our partners and taking into account their expertise in everything from IoT through to telematic, teleinformatics, and a range of other kind of technologies associated with healthcare. The thinking is to move away from the building. And I think if more than what's highlighted the possibility of this more than anything else is probably the pandemic. 2 years ago, you could not have got a telephone appointment with your GP and had a diagnosis over the phone or via Zoom or some tool like this. And this has been the experience of all of my students in the master's program I'm involved with. Now it's just a new way of working. So it's kind of the opportunity here is the same opportunity as existed in fintech 10 years ago. It's for disruptive innovations that will bring the services to the consumer of the services, rather than the consumer of the services having to go to the altar of where the services happen. If you think about all retail banks, you have to go to the bank and carry out your business there. Now, most people don't know what the inside of their local branch looks like. It's a paradigmatic revolution. So of course you have to build that into the maturity model we're developing. But equivalently, we have to take into account what capabilities do both the health service as a system, and not only that, with it's a health service as a system is a series of mini systems aggregated one on top of the other. What capabilities are required within that system in order to effectively support the management, maintenance, and support of that ecosystem, and what does that look like? So it's a multidimensional problem. I think part of the challenge to date is that it's been based primarily on medicine as a diagnostic and and treatment-centric philosophy. Whereas by using the approach we're taking, we're putting the service at the center, and the idea being that what you've got is, it's the provision of those services and the capability to deliver those services as managed through the health service. So the idea is that you can manage your health service in a business-like way, using business principles of efficiency, effectiveness, and performance. Slightly long-winded, I know, but hopefully it gave some idea of the thinking that we're doing when we approach this.
Yeah, thank you, Michael. Just one quick question. Like, do you see scope of everybody having a digital twin, like in the future, where then the diagnosis by the doctor is based on that digital twin, and you don't need to go to the hospital? Is that something which people are working towards? They just want to know what is the status in terms of health and that.
It's a really interesting question, Rehan. I think that's where the thinking is. I'm not quite sure that the medical profession is willing to relinquish its power to enable that. And I can give a good example of that here in Ireland. I don't know how many of you are not in Ireland at the moment. There's an ongoing debate about why our COVID management team won't authorize and endorse the use of antigen testing as well as PCR testing. This is despite the fact, by the way, that when we all go back to work in September, we will be getting antigen tests to ensure that we're COVID-free, because there's been a kind of exemptions made. And what it comes down to is the physicians at the center of the process, and clinicians at the center of the process, essentially saying that in their qualified view as professionals, regular human beings like us don't have the competence to do a kind of blood test, prick test, to test for COVID, despite the fact that diabetics do this every day. So it's a control thing and it's a power thing. And if you think about the idea of a digital twin, it gives autonomy to the patient to take that data set and mobilize it. So once you take that information layer away from the physicians and the clinicians, it diminishes their ability to influence. So you're getting into, I'm not going to get into the whole thing about kind of Bordeaux and stuff, but you're looking at people who are looking at their habitus and their capital being modified by technology interventions, and them having to come with terms over this. So there's a cultural dimension to this that hasn't been taken into account, because we know capability is about technology, processes, and people, and we can affect change in the technology side. In fact, you're doing that in the current thing that you're working on with that organization. We can make changes on the process side, but it's the people dimension that is the most challenging one to modify. Events like COVID will come along that are a forcing function. But when some kind of a Lewin called kind of a refreezing and equilibrium comes back into a system, people tend to perform within a certain bandwidth. So what we have to do when we talk about digital twins is, in a sense, kind of subvert the traditional model of the clinician holding your medical records and return that to the citizen. Now, one of the values here in Europe, we'll be quiet after this, here in Europe, this is the European Commission are calling this the digital decade, if you just search it on Google. And one of the goals for the digital decade is that by 2030, every EU citizen will have a digital health record, which, with the sophistication of current data sets, essentially means hopefully 5 to 10 years from now, we will have a digital twin that is portable and that we can carry with us, and that we can, enables us to get the best treatment for whatever condition we need. So I think it's yes, but it'll be a while.
Okay, good to know. Thank you, Michael, for that.
Yeah, no. What Michael, thanks very much. It's very important what you say, and what you say in the healthcare, and for compare with the digital retail world. The human aspect is very important, where the digital retail, of course, you want to sell a product. In healthcare, you want to sell a product, but you still want to be the owner of everything. So you don't really want to release everything. So you want to, it's kind of selling a product, but not what is behind that. And so you want to keep kind of a part of that, so that you keep coming and you still have the responsibility. And this is a very important challenging issue, because healthcare is not only the digital twin, as Michael was pointing out. It's about the patient empowerment is something that first not all the medical providers like, because it's giving a responsibility and accountability to patients and to remove from the medical professionals. And it's something that is not always seen in a good way. So it's a long way, but in any case, we are going there, and is inevitable, and so that we will move forward.
If I can, just one quick mention, just to say that, in my opinion and experience, both as a patient and also looking at this issue, I think maybe it's not just about the people, but of course it's about their training, the way these people have been trained. I remember many times that I've offered to, I have to go for my blood pressure, stuff with my physician. And every time I'm offering to give like 1 week of data, the guy is terrified. He never wants that data from me, because I record everything. I have my digital monitors, and I'm offering my doctor, my GP, detailed data about my state, but they prefer their 24-hour monitor, which is problematic. So, but I think it's the way they've been trained, that's a problem. And secondly, is also how they manage the data. So you give them this data, how will they manage it? They don't have the capabilities to manage that. So the guy could say, I checked the data that my patient X gave me, and based on that, I am making this kind of decision on. It's really very problematic, for them from a practice point of view. So I think there are a lot of other issues that just makes these people say, look, they say no, but I think the no they say is based on several other factors: orientation, the way they have been trained, processes that they have to follow, so that they can, and of course, even when you talk about the collection of data, Michael, in terms of having a digital twin, where we can actually port our electronic, health records, again, the management of this data, so you need maybe national level infrastructure, then you need hospital level infrastructure. So I think it's really, there's so many things to do, many capabilities to build, retraining, the way new medical students have to be trained for them to be very comfortable with, using a lot of data from various sources, and of course, I think they all know about empowerment. If you look at all the policy documents, patient empowerment is always at the center. Patient experience at the center. I work a lot in that area, so I know that government is crazy about, the all-election of its patients, but they don't. The issue is, again, behind that, there's a more fundamental problem of how they think. So you see like a tension between the way they have been trained, the way they think, and what they actually want, and possibilities also that are out there. So, but I think it's a big area and nice area too, that presents a lot of opportunities for work, research, of course, and all the nice things that you've said here.
My view on this, and it's an education hat on, the function of universities is to solve problems. If you want simple answers, go to management consultancy. They'll give you a 4-step process to do a thing. And that's no disrespect to management consultancies. They make the complex, they take the complex and make it simple. But part of the role of a research institute, in my view, in a university, is to take an unsolved problem and engage with it in some way to define a solution. And, within the spirit of, the empirical process and micro experimentation, we try something and it might not work, but we've learned something new. We've learned that process A doesn't work, so we try process B. So I completely agree, Boyega, that there's a fantastic opportunity certainly in Ireland and in most European countries. The single biggest spend is on health. The one exception to that in the Western world is the US, where the single biggest spend is on guns, weapons, defense. Second only then to healthcare. But in most countries that have a kind of non-centralized system, it's healthcare. So all of these systems are trying at the same time to individually address healthcare problems. So unlike COVID, where they came together and collectively applied their intelligence, you know, the Irish people are trying to do it in that context, the UK in that context, and Germany, and so on and so on. And it comes, you know, so I think that, you know, there's a huge opportunities for collaboration, both with industry and with other universities, and even at the state level, because, you know, it comes back to Clay Christensen's thing about disruptive innovation. If healthcare providers don't do it, then the guys who invent this, who now own this watch, Google, will come along and provide the same diagnostic technology as part of a neat little package, and they will eat the lunch of the healthcare providers. So, you know, there's a kind of a motivated self-interest in progressing.
And this is why it's important, it's fundamental that people really take charge of their health and they understand, because otherwise we will replace is empowerment of machines and not of people. And for example, many times I read about the patient empowerment as the patient who recognizes what is the data and decides who should use his data. But if the patient doesn't understand the data is his own data, how can he or she be able to decide who should use those data? So there are these contradictions that must be overcome with really, and Michael is absolutely right, with education, with campaigns of making people understand to really what's going on, and becoming active actors of their health.
Great. Okay, listen, I've got to drop off, Marco. Great talk.
Yeah.
And good to see you again, guys. So see you soon. And best of luck, whoever is giving a talk and perform.